Alright, good morning. I'm going to do a BiPAP setup. So the first thing I need to do is check the patient's chart, gather any necessary information, if there's any settings that the doctor would like them to try on or be on like that. Keep that in mind. And then make sure you have all the necessary things to set it up, the corrugated tubing, the appropriate filter, a few different mask sizes for the patient to make sure we have everything to make it go smoothly. So when we're ready, we always enter the room, we knock on the door, introduce ourselves, wash our hands, apply appropriate PPE, and then we need to assess the patient, get the pre-vital signs before we place the oxygen, anything on them like that, anything like with giving them breaths or anything like that. So once we're all done with that, we're going to go ahead and get it set up. So here I have a Respironics BiPAP Focus. So the first thing I'm going to do is go ahead and make sure I have everything connected first before I get everything going. So always you want to have your connecting piece here. You're going to have this little filter here. You're going to put your filter here. So this is a bacterial filter. So this is going to help from getting any bacteria up into your machine. Then you're going to apply your 6-foot corrugated tubing, and along with this corrugated tubing, there is a tubing to help for, it'll have a line that goes into your machine, and that will be your sensor to help if there's anything off, if there's any leaks coming from a patient, mask or anything like that. So the next thing that I'm going to do is go ahead and get it turned on when I'm ready to go. I'd like to always check the patient's size, mask size, before I begin. So what I'm going to do is do the measurement test to see, like with the bridge of their nose, make sure it's going to be wide enough and it's going to be sitting on their face properly with them. So when I've got that figured out, I'm going to go ahead and set up the machine. So here we're going to go ahead and push the on button. And it's just going to make a few noises before it completely turns on. Alright, so here we have the spontaneous and timed mode on. So with this mode, so this is going to be it's going to have a timed thing. So if they stop breathing or anything like that, it will always give a time thing. So it'll have an inspiration and expiration time. So we have 16 and 7 for the expiration. The rise time, it'll have a rise time and the rate that you want to give it. So then it can also give you an I time, a ramp time, and a ramp start. So this one, so if you want this one, so you can go down if you need to change anything, different settings for the inspiration, anything like that, then you can go through here and change it to the appropriate settings with the patient's rate or anything. So it will always, if the patient breathes spontaneously, it will always give them a timed breath. That way they know, that way we know they're getting the breath that they need. So if you need to change it to something else like a CPAP, you go up to your mode and hit enter, and you can change it to your CPAP. So the CPAP is often used for patients with sleep apnea, so it's just going to be a continuous pressure. So with this one, what it's going to do, so if a patient stops breathing, the sleep apnea kicks in, and this will give them everything that they need, the breath and everything. So this will show the patient's data like the others. So apnea is 4 per hour, and then you'll get a leak. So it'll show you what the leak is per liters per minute. And with these here, so you have an alarm, so you can set up your alarm. So what you can go is to your change screen. And here we have the apnea at 60 seconds. And so then you can have a give like 20 per hour, anything like that. Have a set up 20 per hour like that. So it will always trigger off if they notice any leaks, there's something with the rates not quite right, volume, milliliters is not to where it needs to be, it will alarm off. So when you want to change anything else, you can hit your change screen again, and you can go down, you can display units, so if you want a different units, you can change it to the MBAR, milliliters water, anything like that, you can change it to that. And so then you go to your alarm volume, hit enter, and so you can hit it up if you want it higher, or if you want it a little lower, but you need to make sure it's at a volume where you can hear it. And when you're ready to go back to your main screen where it shows your mode and everything, you can go back here and make sure you have the appropriate mode that you want, and always remember to activate it. If you don't activate it, it's not gonna give the appropriate settings to the patient. So when you're ready and you have everything set up to the patient's values and everything with their rate, then you go ahead and set the mask up over their head with Velcro. It'll have a Velcro, or you can have even a clip on it. So with that, then you would make sure it's not too tight. Ask the patient always if it's comfortable when setting them up with it. You can always do a finger test, make sure it's not too snug onto them, but tight enough to where they're not going to get that leak, too much leak. So when you're finished with it, you always want to check the patient. Go ahead and get their vital signs. Always check their respiratory rate, anything like that that can be affected when they're put on a BiPAP machine. Make sure it doesn't worsen it. If you notice that the patient is still not getting enough the right time for their breath or anything like that, make sure you get that changed, notify with the doctor, anything like that. And when you're done, always come back, make sure settings are still okay, everything looks good, and then go ahead and check the patient's, go and chart on the patient's charts, notify the doctor that you got the machine on, and let them know if they're doing good on it and anything changes with anything on the machine.